This time what we're going to have a look at is sternocleidomastoid, which is this muscle here, and that's the one that does flexion at the neck, cervical vertebrae. This little section just here is also part of upper trapezius, so upper trapezius actually comes onto the clavicle too from there. And then this is the major part of the upper trapezius, so it comes from the cervical area and comes across the common process and then follows the scapula. Underneath that are all these different kinds of muscles here, levator scapular and splenius muscles. There are several splenius muscles, and underneath that again is part of the erector spinae too. So initially what we'll look at is sternocleidomastoid, how you can do that, and generally that's best done dry, and then upper trapezius from this angle and then into levator scapular, and as well as we get into some of the splenius muscles as well. Chin towards the chest, and then come back again, and again, chin to chest, and then they do that. And again, this depends on why you're doing it as to how many times you would do this. We're just giving an example here. And then if we just let the hand go underneath the head, and what's going to happen from here is that you're going to put a little bit of pressure on here, and the hand underneath the head is actually going to drop away a little bit, and it's just there to catch in case the head collapses, the neck collapses. So from here, so this hand now, keep going, and then just follows up. Now we'll need both hands to come back because this will be quite strong. Come back, and then go up again, and then come down. So again, that could be isotonic. If you were to be isometric, just come up just a short distance, stay there. 1, 2, 3, and let go. And just come up a little bit further, and again. 1, 2, 3, and let go. And then come back. 1, 2, 3, let go. And again. 1, 2, 3, and let go. And then if we do lateral flexion, so we come in to the side, and then go here towards the shoulder, and again, and here towards the shoulder. And if they find difficulty lifting their head up, you support the head, or if they have no problems, just stand to the side and let them ear towards the shoulder, lateral flexion, cervical vertebrae. And then again, and the other side, yep. Back to the center. And this time we're going to come towards this shoulder first, a little bit of resistance, keep going all the way, change hands, come all the way around to the other side. And you'll need to keep talking to the person about, is there enough pressure, is it too hard? And again, just be careful, fingers and thumbs, ears, nose, eyes, etc. And then if you want to do this isometric, push into my hand, 1, 2, 3, let go. Move a little bit further, 1, 2, 3, let go. And then once you've gone to its full extent, you come to the other side, 1, 2, 3, let go. And again, 1, 2, 3, and let go. And then rotation. Just encourage just a little bit to go further. And then the other side. And just a little bit further. And then they do that. And the other side. And then from there, we're going to come towards this side first. Very gentle. Stay there. Come right around. And then you just keep repeating that. If we want to do that isometric, just push into this hand here. 1, 2, 3, let go. Move it to another position. 1, 2, 3, let go, and again, 1, 2, 3, let go, and then we just repeat the whole process going in the other direction. Sternocleidomastoid is this muscle that comes down here. Sterno, attachment onto the sternum. Clido, onto the clavicle. And then up to the mastoid process. Sternocleidomastoid. Now, for Quinn to activate that, all he has to do is basically lift his head off the table. There we go. Now, if we want to activate that a little bit more, give him a rest in the meantime, is for him then to do flexion and then turn towards the opposite side to the muscle, and that makes it stick up even more. So there's the sternal section, there's the clavicular section. So in order to do some massage in this area, always be careful when we're dealing with the throat area. Just curl the finger, and so from there, if that's sternocleidomastoid, then it's a matter of trying to just grab like so, or finger. But just be very, very cautious. If you're not certain, just take the weight of your head, that's it, there it goes, and then let it go really heavy, and then just make sure you just grab the muscle from there, just take it nice and easy, or from there. And then if we want to get to the clavicular section, again, if we can get Quinn just to lift his head just a little bit, there's the clavicular section just there. So if we put the thumb, and then it lets his head go really heavy, and we turn, and then very gently just press, move down a little bit, turn the head, press, and just work down the clavicular section. Now again, pressure is not heavy doing this one. Turn the head, so the sternal section comes over the top of your thumb, and then just very gently press into the neck and just slide across. So you've got a pincer type of movement from there, or just curling and squeezing. Just make sure it's muscle that you've got, and it's not just, that's skin, that's just skin. So we need to get to the muscle itself. But be really cautious, and then from there, press and just slide. Press, slide, press, and slide. Okay. This is the upper trapezius, comes right up from the back of the head, occipital bone, and then comes right around, common process, and then comes onto the clavicle from here. And if we want to get Quinn to try and activate that muscle, all he has to do is to bring the common process towards the ear on this side, and that will activate the muscle quite dramatically from there. To do a dry type of massage, then if we keep the fingers all closed up, and we're just going to use the edge of the finger, and it's a saw type of action. We're going to elevate the scapula, so push that up, and 1, 2, 3, 4, let go of the scapula and move to a different position. Push up, 1, 2, 3, 4, let go, push, and then move the finger to a different position. So it's a saw type of action, and it's a transverse friction. And then for the part of the neck, from there, just use the thumbs and very gently just work across the muscle fibers of the upper trapezius. Underneath there, coming in this direction, is levator scapula. So levator scapula comes from the superior angle down towards the spine of the scapula, and it's like 4 little fingers that just comes up into C1, 2, 3, 4. So the best way to get to that one is again to elevate, and once we feel underneath, so we come into the anterior portion of the upper trapezius, we feel for something that's just like the elbow, and it's the superior angle of the scapula. So we elevate, try to locate from there. And then once we've done that, it's just like a really cross fiber. We just work from the superior angle and then go all the way up to C1. So what we've just done from there is to elevate and the saw. Keep all these fingers closed, so don't try and do with just that one finger. Don't try and do that, the joint will get really sore. So close all the fingers and sandpaper, saw. And then into the neck area, always be careful into the neck region. And then for levator scapular, we elevate it, just push the scapula up. And then feel for the superior angle, and then it's just a matter of working the finger underneath. And from here, if you want to do compressions, then you do your compressions by just squashing against the muscle. Just be really cautious into the neck area, if at all. Squash down and then make it happy. What we have done so far is to do some actions of the neck, biomechanical actions, and then we've got them to do some exercise to encourage blood supply into the area. We've done dry massage, now we can do some oil massage. And then from here, if we just elevate the scapula, use your thumb. Your thumb is an indicator of which direction the muscle fibers are going, and we just slide across the muscle fibers. And when it comes to being working into the neck region, it's just a matter of just sliding across, just with the thumb. Elevate, thumb in the direction of the muscle fibers, go across this particular section of the muscle fibers. Move to the head to do the cervical part, lift up the skin and just roll over, just a very small rolling over into the neck area. You can do some compressions and some make happies. Then from deep tissue goes with the muscle fibers, so we can use the flat part of the fingers, and from this direction then it's just a matter of working up nice and slowly, really easy. And then again just finish off by making it happy. And then we do the same thing coming from the other side, so just really quite vigorous, providing there's no problem. And then from there, lift up, slide across the neck. We can do some compressions. 1, 2, 3, 4, 1, 2. And then some vigorous, make it happy. Deep tissue. And make it